Dr. Quinn, why is getting the flu shot more important than ever this year?
Andrew, it is so important this year. I mean, we're right in the middle of this COVID-19 pandemic, and right now our healthcare system is stretched so thin. I mean, our hospitals, our emergency rooms, our clinics, I mean, they're almost at full capacity. Anything we can do to keep ourselves or help ourselves to have a better chance of not getting sick is such a smart move. Right now, the CDC, they're urging everyone 6 months of age and older to get a flu vaccination, especially this year, because if someone were to get the flu because they didn't get the vaccination, then they could also get COVID-19, and hey, that's a hard combination for our immune system to fight against. It's so important this year that we get that flu vaccine.
Now, what about people who've been working from home this whole time or simply don't trust vaccines? What would you tell them?
Well, working from home is definitely going to help, because the deal is there are a lot of precautions in place right now because of COVID-19 that will actually help, because the flu and the COVID-19 virus have very similar means of transmission through the respiratory droplets. So the face mask, the social distancing, the hand hygiene, all that's going to help. But the flu vaccine gives you an extra layer of protection to protect yourself. And it's really the thing that you want to do right now. Now, I also want to note that a lot of my patients will ask me, to this day, from when I first started, if you get the flu vaccine, will it cause me to get the flu? The answer is no. The vaccine, it doesn't cause you to get the flu. Now, there have been instances where people have gotten the vaccine and maybe they get the flu, but it takes about 2 weeks for the body to produce the protective antibodies to help protect you. So you may get the vaccine, and then in the interim of the 2 weeks, you may be exposed to someone with the flu. Before you have the antibodies, you can get the flu. Or if you get in maybe contact with someone with a different strain of the flu than the vaccine, you can get it, but you cannot get the flu from the flu vaccine.
All right, and it is possible to get COVID-19 and the flu at the same time. Any idea what that would do to just a normal, healthy person?
I mean, first of all, I just want to reiterate that the flu is something that should be taken seriously. I mean, the CDC put out the estimates from last flu season. 35 million became ill. 34,000 people died from the flu. But if you get the flu and you get COVID-19 at the same time, which you can do, then your immune system has to work extra hard to fight both infections at the same time. And this is something we don't want, because it'll make it much harder for someone to recover. So let's get that flu vaccine and try to help protect ourselves, because it's so important this year.
All right, Dr. Timothy Quinn, that is a double whammy that nobody needs. Thanks for spending some time with us this afternoon.
Hey, thank you for having me. Let's get these flu vaccines, because we have to look out for everyone, because this is a very tough time.
All righty, Dr. Quinn, you're watching 12 News at noon.